As of July 4th, Missouri's medical marijuana program registry is now open. So that means the state is accepting applications for medical marijuana identification cards. But in order to get one for Missourians, they must have a certification letter from a licensed physician within the state. Springfield's two hospital systems, Mercy and Cox Health, recently said they are not going to be seeing patients for medical marijuana cannabis certifications. So that leads us to the question, which doctors will be prescribing it? And that's something Gregory Holman, a journalist with the Springfield News Leader, has been looking into and doing extensive research on medical marijuana
since the election
as Missouri transitions. Thanks so much for being here tonight.
Thank you for inviting me, Heather. So the question of who's going to do this, I mean, Mercy and Cox came out with basically what's been a pattern in all of these states where a medical cannabis law comes in, which is if you're a hospital, you're getting money from the federal government to run Medicaid and Medicare coverage, and they don't want to jeopardize their relationship with the federal government is what it boils down to. So a lot of different options step into the mix. In Springfield, we have independent doctors. There's a clinic called Elite Pain Management. There's Dr. Mobley, Dr. Roark over in Cassville, and we've reported on all this. There's more that have emerged since then. There's also this phenomenon where you call it like the cannabis clinic, and this is basically they open specifically to connect doctors to patients. You bring your medical records, and if you have cancer or PTSD or one of the issues that's on Missouri's list of conditions for this, you can get the paperwork you need to go to the state, which they've been doing, as you said, pretty much recently.
And there's been about 29 businesses in Springfield alone that have applied for a facility to do medical marijuana.
So the way that works, this is going to be a huge issue, I think, in this industry coming up. The way that works is there have been 554 companies, or at least applications, that they've pre-filed to the state officials. The state is going to score the applications and choose who gets a license to do a dispensary, who gets a license to do a commercial grow operation, or a testing lab, or a manufacturing facility, which that means basically you would process marijuana to create things like what we would call edibles, like you've seen out in Colorado or California. And they're going to start doing that August 3rd. So, but before that, they took in application fees, which are as much as 10 grand for a cultivation operation just to file the paperwork. So they have about $4 million so far that they're using to spend on the program, and ultimately some of that money goes towards veterans care, which was the point of Amendment 2 back in election time.
So there's a lot that goes into transitioning into medical marijuana, a medical marijuana state. Let's specifically talk about the doctors as well, because this is something that they're not trained to do in medical school.
Right. What was really interesting to me was, as I've been reporting on this issue, I interviewed Jim Blaine about a month or two ago, and many of you guys will know him because he's been active on DWI issues and on public health issues for many years. And he straight up told me that he was like, naive was the word he used on this issue. I mean, they plain do not really talk about it in medical schools as far as what you would go through in your residency and all the different things that doctors study before they become doctors. So there is a whole debate on should the medical community become more accepting of this, and part of that issue surrounds the simple fact that there is just not a lot of not a lot of research on medical marijuana issues in the United States. And that's because it goes back to this is a substance that's prohibited by the federal government. So there's one small program out of University of Mississippi that does some legal research on marijuana, but other than that, it really happens in other countries. And so some people say, let's take it off of the Controlled Substances Act list and make it to where at least research can be done.
And so these doctors who will be prescribing it within the Springfield area or in the Ozarks, they're going to have to do the research for themselves and really just prepare themselves on the benefits and, you know, how to prescribe it as well.
A lot of it comes down to, and I've seen documentation out of Missouri State Medical Association, a lot of them are looking at what science has been done. For example, one of the strongest arguments, at least that the pro-cannabis community has, comes out of a journal from the American Medical Association study from about 5 years ago, and that study found that in medical marijuana states, there's a lower opioid overdose death rate. So states with the medical marijuana have lower death rate from opioid issues. So, I mean, the doctors definitely are educating themselves. The ones who are in favor of medical marijuana are all the time telling you when you interview them what they've learned, certainly.
Very interesting indeed. Now, you also mentioned that August 3rd is the next date, I guess you could say, to look forward to in this process.
Right. If you are an entrepreneur in this industry, large or small company, this is a huge date because it's the day Missouri is going to start evaluating the license applications. So if you want to have a dispensary, which is what, you know, a retail store that sells marijuana products, if you want to have a commercial grow operation, you need a license from Missouri. They're going to give out about 340 licenses. 192 of those are dispensaries, and they start taking those applications the 3rd. And they're going to take them for about 2 weeks, and then they're going to score them. They're going to actually contract out to get a third party so it's as fair as possible according to the state. And then they have to, the Constitution says they have to hand out those licenses by December 31st. Meaning, the big question I always get is when will there be dispensaries?
Exactly, yeah.
Basically sometime next year. It seems like it may be sometime next spring.
Okay, and you will be following it.
We're going to be following
it
at the Springfield News Leader,
and
yeah, at Color 10, most definitely.
Okay,
yeah.
very good. Well, thanks so much for being here to kind of share what you've learned along the process as well. You can find that all on our website and at the Springfield News Leader. This is Greg Holman with the Springfield News Leader, a journalist. Thank you so much for being here.
Thank you, Heather.
We'll be right back.